If you had the opportunity to make it a little bit easier for your neighbors in need to receive veterinary care, how would you go about doing that? What are a few things that you might consider when trying to make veterinary care a human right? Something that is not designated just for people with money, something that is not a status symbol, but rather something that everyone who has an animal could potentially have access to. So, these are some of the questions and ideas that we are going to explore today on the Street Dog podcast, brought to you by, of course, the Street Dog Coalition. We are a national nonprofit providing free veterinary care and related services to pets of people experiencing or at risk of homelessness. And I'm your host, Daria Tabana, and I'm also the Director of Development at the Street Dog Coalition. And I am so excited to introduce today's guest. We started talking before this episode, and I almost forgot to start the episode. So that's how I know it's going to be a good one. So today's guest is Dr. Dennis Chmiel, co-founder of MySimplePetLab. Dr. Chmiel is a dedicated veterinarian with a passion for making pet healthcare more accessible to everyone. So through MySimplePetLab, he is helping revolutionize the way pet guardians access veterinary services, particularly for those in underserved communities. So today he's going to share some insights on the innovative solutions his team is developing to break down barriers to care and how they can impact the future of veterinary services. And without any further ado, welcome to the podcast, Dr. Chmiel.
Thank
And
you so much.
thank you. And I realize I'm calling you the co-founder, but you also have a second very cool title that I saw in the signature of your email today. And what's your other title?
Oh, Chief Medical Innovation Officer for MySimplePetLab.
I
Right? It sounds
love that.
sounds super fancy. Um, but no, thank you so much, Dario. I'm so happy as a company to be friends with Street Dog and friends with you. And so it's a real pleasure to be here today and talk to you. There's a lot of companies out there, for profits and not for profits, that are really trying to solve this access to care issue. And it's not something that 20, 30 years ago we spent a lot of time talking about, and really trying to solve for. But today that's different, and it really matters. And I love how you just talked about in the introduction about pet guardians and the human right aspect, right? Like the human need to bond, not just with our own species, but with other species. Like that goes back, more than just a few generations. That goes
Yeah,
back, millennia.
absolutely. I really appreciate that. I'm actually reading a book about our relationship with animals and how we have evolved alongside them over time and all the different relationships we've had with them. So this is going to be another podcast episode for another day. And
Excellent.
and in the meantime, let's start with a question that as I'm looking at this question, I'm like, oh my God, this is a heavy hitter of a question.
Oh,
So you already know that at the Street Dog Coalition, we're super, super passionate about improving access to care. It is our lifeblood. It is the most important thing to us as an organization. And I'm laughing at how huge of a question this is. But I can't help but ask, what are your thoughts on the current state of pet healthcare access?
oh my gosh, right? Yeah. Here we go. Let's talk for an hour. Uh, yeah, it's the access to care. I think in my mind it goes into really kind of two areas right away, which is that phrase spectrum of care, right? That the same sort of care offering to everyone doesn't work, right? As my own sort of personal and professional journey, when I graduated veterinary school and became a primary care veterinarian for dogs, cats, and exotic animals. I As part of my practice, I, was trying to get better and better and better, being able to offer more and more things like over time, so that as clients came in to our practice, I could offer them the best care possible, the most gold standard care. But as my career progressed, I started to understand over the years that while that approach really worked for a lot of people, a lot of pet parents, pet guardians, it didn't work for everyone, and there's a whole big percentage of people that weren't coming to my practice at all, right? That it just the exam fee wasn't affordable, or people that were coming to the practice that um, uh, we're doing the right things by trying to get veterinary consultation, but then the products, the services that were offered were just represented a financial barrier, or an educational barrier
Mm,
or even a philosophical barrier that they
yeah.
couldn't, get through. And so, over those decades, I became just increasingly aware that, one size doesn't fit all. And from a spectrum standpoint, how can we really meet people, where they are and, based on the resources they have and offer them, the best options. It may be the case that, you could still offer, a premium option in certain circumstances, but being really aware that it's, not having a pet parent feel guilty if they can't do that, right? They don't feel judged if they can't do that. And what are the other options available? And I think that kind of leads me also to this sort of second concept that I think about a lot. So the spectrum of care, that just broad offerings, to meet people where they are, but also this concept of incremental care, which
Mm,
is a step-by-step approach. I remember that there was a period of my career where, we were taught, by industry consultants to really try and not be part of that conversation as veterinarians. Like, let's put together an estimate, right, for a pet parent of everything that, we think as a medical professional that that pet parent should do, and then hand that to somebody else in the practice to go in and get a yes or no. Uh, and it really, I think, was not about a yes or no, or shouldn't be about a yes or no.
yeah.
It if it's not a yes, for you know everything that you want to do as a medical professional, what can it be a yes for? And sometimes taking a step in the direction, being able to show that, okay, like maybe doing one thing or maybe doing a couple things can get us some positive results, meaning that we can provide relief or comfort to a pet that's uncomfortable, or take a step that makes that pet healthier. And maybe it's not all the things that we want it to do, but if we can start taking steps in the right direction and bring those pet parents along on that journey, it'll build confidence and a willingness, if they've got the resources, to take additional steps. So the spectrum of care, incremental care, those are things that are on my mind a lot,
Mm.
nowadays, in terms of how the veterinary industry approaches healthcare delivery.
I really appreciate that. And I appreciate this idea of, empowering individuals and putting them in the position where they can be decision makers in regards to their pet's health. I think, it's sometimes easy to forget that if someone is coming to you with their pet, they to some degree care about this pet.
Absolutely.
They to some
Yes.
degree, they're adults for the most part. They're capable of understanding at least at like a rudimentary level. I say this because while I'm not a Street Dog Coalition client, I am also not a veterinarian. And I always appreciate whenever a veterinarian, regards me as a fully thinking human being that is capable of understanding somewhat complex things. And
Huh.
it always makes a difference to me when, my veterinarian is able to kind of break things down for me in a way that I can understand. So can you maybe tell me how, the efforts you're taking at My Simple Pet Lab, how does that kind of play into everything you just shared with me?
Yeah. So Myself and my co-founder, Dr. Nancy Willerton, we've known each other for decades, and she kind of went along a similar sort of journey of really starting to appreciate the need for providing access in different ways, and we got especially passionate around things that could be done, from the home environment that veterinarians would be comfortable with, right? There's lots of things right out there, on Amazon, through Google, that can be done for pets at home, and some of those things veterinarians and veterinary technicians feel comfortable with and like and feel like, okay, that's safe, or that has a high safety profile, I should say, and is likely to work, right? High efficacy. And then there's lots of things out there that we're just like, oh gosh, like what did you put in the dog's ear? Like what did you rub on the dog's skin? Like stop, stop, stop. Right. So there's a lot of that out there as well. And so, we became uh, uh, increasingly aware, especially on the diagnostic side, on the test side, that there was a need to be able to offer diagnostics from the home environment or from the travel environment, from wherever, being just like not like if you're not physically in the clinic, to be able to offer diagnostics that were more accessible. But um, and I will say that we were inspired some from what was happening in human healthcare, right? Like
Mm,
in the early and mid 90s, Ancestry.com, and then the early 2000s, 23andMe, and then kind of fast forward to today, there's Cologuard, right?
yeah.
Where human fecal samples are being, sent through the mail, for colon cancer testing, and that arguably is like I believe that in human healthcare. A colonoscopy is still considered gold standard. That's the best. Everyone at a certain age should get, a colonoscopy at a certain cadence, but like for a whole variety of reasons, not everyone does that. So does
Right.
that mean like they shouldn't get anything? Or are there
Where's that middle ground? Where's the in between? Where's the gray area? How can this not be like an all or nothing sum game?
exactly, right?
Yeah.
And so maybe like for people that can't or won't get a colonoscopy, they could at least do a Cologuard test from home, and then based on those results, that may help them get to a colonoscopy, right? Get them that next step. It's sort of an incremental, stepwise way, to maybe get to best treatment if that ends up being recommended. But what really changed the game for us was COVID. We launched the company in 2019, like right into COVID, basically, which was hard. But
Wow.
one of the sort of silver linings for us as a company that came out of COVID was the everyone did a test either at home, like
Yeah.
in their home on their kitchen countertop, or they sent it to an external laboratory, sent a COVID test out for like so it was the antigen test on the kitchen countertop or a PCR test, was sent out to an external laboratory, to sending it out to a professional laboratory, getting results back directly that they could share with a local or virtual physician. And so people really became to understand like you could do a legitimate diagnostic test, from home. And so that was really helpful
Mind
to us
blowing.
because like,
Mind
right, like
blowing.
if I can do this for myself, like why can't I do this, for my pet? Why aren't there those sorts of options? And so we've been that's really our core of what we do as a company is create authentic diagnostics tests that pet parents can do from home, where they can send samples to a professional laboratory, get results back directly that they can and in a way that they can engage with and understand, because normal lab results are not designed for pet guardians. Like
Yeah.
they're designed for
Yeah.
veterinarians and veterinary technicians, and so it's, generally it's a bunch of hieroglyphics, and it's not meant, right? It's for the language of the veterinarian. And so we
This
deliver
is
results
fascinating.
that pet parents can really engage with and understand, and then make it easy to share with a local or a virtual veterinarian.
Oh, this is so cool. I know that we talked a little bit about my dog barking at Amazon delivery people. So you already know I love not leaving my house. And you know, it's of course to me a luxury to be able to do things without leaving my house. But to some people, you know, our clients especially, who are navigating life on the street, or they're, you know, they're in transitional housing, and sometimes going to their veterinary provider, if they even have one, is just not realistic. The
Right.
solution you're providing is more than just like a matter of convenience. It could be the difference between life and death for an animal. It could be the difference between being able to, you know, rest assured knowing that your animal is taken care of, or, you know, being in a full-blown panic that your best friend, you know, is throwing up or is not feeling well, and you don't know what to do about it. So my question for you is how do these home test kits work when there is or there isn't a veterinarian for the pet? Do you notice that some people try to take these results into their own hands, even if that's not recommended? What does that look like?
Yeah, that's a great question. So what we started as a company, we started direct to consumer. So our .com and Amazon. So we got, uh, I would say, really good over time. You know, as we iterated versions of test kits, with being able to provide a pet owner an ability to purchase a test kit and open up that test kit, go through the sample collection, like the activate the test, sample collection, and mailing instructions in a way that was really easy to do, and in a way that helped them, have maybe having never done it before, collect a sample, whether that be a stool sample for a dog or a cat, an ear swab sample for a dog or a cat with a suspected ear infection, or a skin swab sample for a dog with skin irritation, to do that safely and in a way that gets a really high quality sample back to the lab.
Mm,
And so uh, uh, on the direct to consumer side, meaning that, you know, we're a pet parent, whether or not they have a veterinarian, can purchase a test kit, um, collect a sample, and get results back directly. They don't have to include a veterinarian, and that is important because not everyone has a veterinarian, as you
right.
know. Not a, and some people don't want a veterinarian, right? They, for whatever reason, they don't want to engage with the profession. And we hope through our process of education to help change those minds with those people. But there's also, for that, some of the barrier issues, you know, we talked about, and many more. Uh, they don't have a way to, you know, discuss results with a veterinarian or access like a veterinarian locally. And so what we've done is we've created a learning center with like simple links. So let's say a pet parent does a stool test on their dog, and it comes back positive for a worm. What we do is we first provide evidence of that finding. So anything that's under the microscope that's abnormal is photographed, and that photograph is included on that pet's report. So it's a specific photograph of that pet sample
Wow.
abnormality. So if they do share it with a veterinarian, or for them to see it themselves, because sometimes like seeing is believing, right? Like, you know, it's like what the dentists do now, human dentists, right? They always like want to take pictures and show you right there, because like when you see it, it's more impactful. It's like, oh gosh, like that is a problem. I need to deal with it. And so we provide in the Learning Center a lot of options. So we don't prescribe, and we don't give patient specific advice, but there's a lot of general advice that you can give around, say, a worm or a cytology test, you know, from an ear that is full of yeast, that can really help a pet parent understand like what's going on and what treatment options are out there, either over the counter, you know, or prescription through their veterinarian. And we know today, right? Like let's, you know, be honest, like pet stores sell tons of over-the-counter products, whether it's online or you know, physical retail. Uh, dewormers for dogs being an example, right? And people, the only reason they're selling them is because people buy them, right? There's a market for that. People are trying to solve problems.
Yeah.
And so early in our early days, we felt like, well, if we could help those pet parents get to like a real answer instead of guessing, and to know like, hey, this is a roundworm. Now I know I've got to treat these roundworms. Then hopefully they're making better over-the-counter decisions if they're doing it that way. But our job as a company is we're always trying to direct to the local vet, or if you don't have a local vet, to a virtual vet. And we put in a link, for these pet parents to like help them even try to find a local vet, if they can. So we're trying to get them back to the veterinarian. And what we find is that because we make it easy for pet parents to share results, we see a lot of activity where when there's a positive, a result results get shared with a veterinarian. And so we
Oh,
know it's like,
wow.
okay, like they're making that connection and they're discussing with someone with a medical professional. So that's great. That's what we want. But that's on the so we do on the access mission, like we're passionate about making it easier for pet parents, not judging, like get to
Right.
tests to help them get to answers. Um, but we do work a lot with the veterinary profession directly to help veterinary practices increase access for their own clients as well. Because one thing that's underappreciated, right, is like just because you went into the vet once and you became a client, or maybe you go in once a year, that doesn't mean you're able to engage with all of the recommendations made by a veterinarian or that
Right.
veterinary team, right? There are still access problems for those clientels of
That's a
veterinary
good point.
practices.
Yeah, that's a really good point, and we've kind of noticed that as well with our street clinics. I mean, I appreciate everything you just said. It's kind of amazing the parallels that that I can make between, your efforts and our efforts at the Street Dog Coalition, and it's pretty amazing how like whether people are caring for themselves or caring for their pets, you can tell them to do 10 things, right? But if you're lucky for one reason, or if you're lucky, then they might do the first few things. And oftentimes that has to do with, the reason why they don't get through that full list. Those reasons have, I think, various origins. Sometimes
Absolutely.
it's
Yeah.
because they forget. Sometimes it's for financial reasons. Sometimes they haven't bought into that solution yet. So I really
Yes. Right.
appreciate how you're being very careful and very realistic with the expectations you're putting on yourself and pet parents. And it's very obvious that you have your finger on the pulse of our clients, people who want the best for their animals, but sometimes are not financially in a position where, they can care for their animals to the best of, their ability. Or sometimes these are individuals who have just been rightfully so, like disillusioned by a lot of the
Right.
systems that are, that just exist
Right.
in our world, whether they've been disillusioned from their own medical doctors. There's so much to unpack there. We gotta schedule, like, a 10-part podcast
I know,
episode,
right?
but I
It
just I
is.
wanna
Yeah.
acknowledge and appreciate the fact that, you are meeting people where they are at. You are providing them with very actionable solutions, real results. I love the transparency of including a picture in those results. I love that you're hearing that, how when people get good news, they're more eager to or able to connect with the veterinarian. I was just telling you before our call how
Right.
sometimes we get people who come to our clinics, who's, they're regulars and at the moment their animal is doing fine and they come to our clinic to just say hi and bring their dog back. And maybe their dog made a friend at the last clinic they were at. So they just want that dog to see if they just bring their dog to so their
Right.
dog can hang out with their new friend. So it is, I think,
Such a
imperative upon.
relationship business, right?
Right?
It's yeah.
Yeah. Yeah. I think it's imperative upon us at the Street Dog Coalition and you and your team at My Simple Pet Lab to create an engaging, encouraging environment and, kind of like this judgment free zone, if you will. So, my final question for you before I wrap things up and start thinking about our 10-part podcast episode in the
I know,
future,
right?
because
New
we have
series.
like so much to talk about here. Tell us a little bit about, I know we were talking about this before we went live and started recording, but how do you envision the potential, continued collaboration between My Simple Pet Lab and the Street Dog Coalition? How are we going to work together? And I'm asking this like because I literally don't know. I want our audience to know. This is not a leading question. Tell us what your thoughts are, Dr. Chmiel.
Yeah, I think, for us and others that are passionate about the access to care mission, right, is that we need to continue, in this ecosystem to work together and ideate and come up with new and, interesting and impactful ways to empower pet parents, right, to keep them involved and give them steps, to help their pet, and ultimately that helps the bond, right, between those humans and those pets. You can't just as a quick aside, like just thinking about everything that happened with Helena recently, and just
Mm.
seeing pictures of people like I read a story, seeing pictures of people like in boats, right, like with their dogs and their cats, and I read a story of people that had to get out a second story window and put their cats in like a tote. Like people do
Mm.
everything possible, right, to like keep, their pets, with them because they are truly family members, regardless of your socioeconomics. And so I think, for us, we've been engaged in supporting the Street Dog Coalition through donation of products. We have some products on the care side that we've made available that are over the counter. They're kind of like as
Thank you
close
for
to a
that. Just want to give you a
oh
big thank you for that.
our pleasure, and I look forward to doing as a company a lot more of that, as we
Yeah,
go forward. But these are products that are as close to a prescription as you can get while still being over the counter,
it's amazing.
and really intended to help pets that are uncomfortable, for or that are struggling. Like if you don't have a lot of resources and your dog's got soft stool or diarrhea, and the only path you can see is going to a vet, and maybe that's not accessible for whatever reason to you, then like what do you do? Like there's
Yeah.
got to be options for these pet parents to kind of help them, like, here, put this combination of things together and give this to your dog, and probably 8 times out of 10, that's gonna, get you through.
And I
So
should say, oftentimes these individuals like email us in the middle of the night, say rightfully
is
so.
that right? Yeah.
Yeah, like concerned about their animals, asking, what we can do. And oftentimes it's tough for us because most of what we do is preventative. And, we're not able to diagnose these issues over email. And sometimes our next clinic in that area is not for a few weeks, sometimes a month or so out. So go ahead, I'll let you finish. But yeah,
Yeah.
those, we,
And
we, we get those people that, they flood our inbox and we don't blame them. They Google what they should do and Google directs them to us.
and maybe there's some opportunities probably for some synergies there,
Yeah.
corporate phrase, but so some work that we could do together there. Like, one of my learnings from talking to you, Daria, is just the amount of people that come to receive services from Street Dog that have email, right, that have access
Yeah.
to their phone or their computer, and so that does open up the door from a testing side as well. Like for us with our test kits, we need to be able to deliver results to somebody, right? And so,
Right.
but if they've, and really that's as simple as an email. And so, for those that have access in that way, there may be an opportunity to stepwise take a pet parent, that's maybe struggling, with access to care, and getting them some answers, helping them get to some solutions in a more efficient, cost-effective, way that maybe just doesn't exist today. So I think there's a lot of opportunities, a lot of things that I think probably a year from now, we'll, have another conversation, and
Yeah.
we'll be like, oh, look at all these things we did together over the course of this year that we just
Yes.
hadn't thought about before that.
Oh, this is so exciting. Yeah, I know when we were talking before we went live, the ideas in my head started spinning. And I know that, when I loop our medical director into the conversation, she's going to get really excited as well. And yeah, it's quite amazing how, our clients, they are informed. They are, plugged into the world that exists around them. And I say that with assurance and without any like surprise at all. And so I think oftentimes we forget that about our clients. And it is important to acknowledge the fact that oftentimes, while they might not have a roof over their head in that moment, you
Right.
better believe they have an email address, and you better believe sometimes they check their emails more often than like other professionals in the space that we work in. I'm wondering, like, hello, did you
Right.
get my email? It's been 3 weeks, but not our clients. They email us, they ask us for medical records, and they ask us, a series of questions whenever, questions arise. So,
Right, and empower them with the right knowledge
yeah,
and help them prioritize care, right? Like they might not be able to do everything,
right.
but if they've got a problem to solve, if we can help get them answers to that problem and point them in a direction, that gets to a solution. I mean, that
Yes.
really matters, right?
Yes, yes. And I think it makes a world of difference in the lives of our clients, in the lives of their animals, and in the lives of our volunteer veterinarians and just all of our volunteers who hate encountering really tragic situations at our clinics, especially whenever these are situations that could have been identified and addressed remotely, before the client had to even wait for that clinic to happen. So, Dr. Chmiel, I want to
Right.
thank you so much for taking the time to chat with me today. You are awesome. You are such a beloved member of our Street Dog Coalition family. I am so so excited that we got you here on the podcast today. And I also want to thank everyone who's listening to this episode. It makes a world of
Thank you.
difference to have your insight and to have your support. We love our audience, and I gotta let you go, or else I'm gonna keep asking you 10 million more questions, Dr. Chmiel.
Oh,
But
Daria,
this has
thank you
been a
for
pleasure.
all you and the Street Dog Coalition is doing. It's really important, and we're happy and excited to partner with you all.
Yay!
Thanks for
Thank you
having me
so
today.
much, Dr. Chmiel. You bet. Take care. Until next time.